This summary highlights the benefits, eligibility, and added services available to Roseville area schools employees for the 2026-27 plan year. If you are attending an orientation or onboarding session, a copy of this benefits guide is in your folder, along with a handout showing insurance costs based on your employee group and the insurance enrollment forms. You can also find the benefits guide and more detailed information on our website. Under the Services heading at the top of the screen, click on Human Resources, then on the Employee Benefits link on the left side of your screen. Benefits are available to all full-time employees working 30 hours or more each week and their eligible dependents, a legally married spouse, and children to age 26. Some benefits are also available to part-time teaching staff. Medical insurance starts on your first day of work. Other benefits begin the first day of the following month. You have 30 days after your eligibility date or start date to return your enrollment forms to Human Resources. Special enrollment periods are available for qualifying life events like marriage, birth or adoption, or loss of other insurance coverage. You have 30 days after that event to make any necessary coverage changes. You may also enroll during our annual open enrollment, which is held every year in May for our insurance plan year starting on July 1st. This page offers more of a description to some of the insurance terms that you'll hear in the next few slides. The district offers 2 deductible medical plans through Health Partners. In looking at the coverage, a deductible is what you pay for medical care before insurance payments begin. If you choose single coverage for yourself only, you will have a $1,500 annual deductible, meaning that you pay the first $1,500 for in-network medical expenses. Once you reach your deductible, Health Partners will begin paying 80% of eligible charges, and you pay 20%. That is called coinsurance. Once your deductible plus coinsurance reaches $3,000 for eligible in-network expenses, you will have met your out-of-pocket maximum. That is the most you would pay in a plan year, which runs from July through June. Health Partners would then pay all eligible expenses in full for the rest of the plan year, which again ends on June 30th. The in-network family deductible is $3,000 and your out-of-pocket maximum is $6,000. If one member of your family has higher medical costs, that person's deductible would be met once they reach the single $1,500 deductible. The rest of the family would continue to have their charges applied until the family deductible amount is met. Preventive care is covered at 100%, no deductible, so we encourage you to go in for your routine physicals, eye exams, and cancer screenings. The pharmacy benefit is a $15 copay for a 31-day supply of generic and name brand drugs. Prescription drug copays are not part of the deductible, but they do count towards your out-of-pocket maximum. If you take any maintenance medication, ask your doctor to write your prescription for a 90-day supply. You could then receive a 3-month supply of medication at your local pharmacy for the cost of only 2 copays. It is important to stay in network. As you can see at the bottom of the chart, deductibles and out-of-pocket maximums are much higher if you are out of network. This is the summary for the Health Partners Open Access Network. This is their largest network of providers for you to choose from without worrying about referrals. If you are traveling outside of the Health Partners service area, you will still have in-network coverage through Cigna, which is their national network. You can find participating providers at healthpartners.com/open-access. Page 5 shows the summary of the second medical plan option under Health Partners Select Network. The in-network deductibles, coverage, and pharmacy benefits are the same as the open access medical plan, but the Select Network plan is limited to a much smaller network of Health Partners and Park Nicollet doctors, clinics, and hospitals. Because of the smaller network of providers, your premium costs are lower. If you choose this plan, be sure to stay in network because the out-of-network deductibles are much higher. If you are traveling outside of the coverage area, there's only coverage for emergency, urgent care, or emergency transport services. You can find providers at healthpartners.com/select. The copay medical plan is no longer available, so we will skip over this page and move to Health Partners Value Added Services. Once you receive your Health Partners insurance card and have a member ID number, create an account on Health Partners website or download their mobile app so you can access your medical plan and learn about their value-added services, like the Nurse Line, available 24/7, a healthy pregnancy support program, OMADA, their diabetes prevention program, and support for back health and behavioral health. Through My Rewards, you can earn up to $245 each year just by participating in healthy living activities. Health Partners offers virtual care for any non-emergency illness or injury. Virtual is available for members enrolled in any of our medical plans, while Doctor on Demand and Teledoc are offered for those enrolled in the Open Access Network plans. Covera Health is a district-paid benefit for anyone enrolled in the district's medical plans. Covera offers virtual care, but takes it a step further. If in-person care is needed, a clinician will come to your home or your work for same-day primary and urgent care for you, your spouse, or child under age 26. Covera offers 30 free lab tests and access to thousands of other heavily discounted labs, as well as 300 free medications. You will automatically be enrolled in Covera if you enroll in one of our Health Partners medical plans. When you enroll in one of our deductible medical plans, you'll automatically receive an HRA VIBA spending account through MedSurity. The district will contribute a certain dollar amount each month, depending on your employee group and your medical plan choice. You can use the money in your VIBA account to help pay medical expenses like your deductibles, prescription copays, dental care, and eyewear. VIBA account balances roll from year to year, and if you resign or retire from the district, the funds in your account stay with you. You'll also have an online account with MedSurity. Watch for a debit card that you'll receive in the mail. When you use your debit card to pay a medical bill, the IRS requires that you substantiate your claim by sending MedSurity a copy of the explanation of benefits or a detailed itemized bill. This will show that you are using funds for an eligible expense. If you do not send documentation, MedSurity will temporarily freeze your debit card until your information is received. There is an exception. Substantiation is not required if you are using your debit card to pay for prescription copays. The district offers two types of flexible spending accounts called FSAs. A medical FSA is a way for you to set aside pre-tax dollars that you can use for medical, dental, or vision expenses incurred by you, your spouse, or dependent child. Unlike the VIBA plan, this account is completely funded by you. The amount you elect to contribute to your medical FSA is deducted evenly from your paychecks throughout the school year. However, you have immediate access to your full election amount right away. Funds in a medical FSA are intended to be spent during the plan year, which ends on June 30th, so be careful when making your election. You may only carry over up to $680 of an unused balance to the following plan year, and anything over that amount would be lost. Medical FSA dollars would be loaded onto a debit card from MedSurity. It will be the same debit card holding your VIBA account. The debit card is designed to use FSA dollars first before pulling funds from your VIBA account. Like the VIBA plan, the IRS requires you to substantiate a medical FSA claim to show that your pre-tax dollars are being spent on eligible expenses. A dependent care FSA allows you to set aside pre-tax money for daycare costs for children up to age 13, before and after school care, or for care for a disabled spouse. You fund the account through payroll deductions and file claims to be reimbursed from your account. Funds are not available on a debit card. Unlike a medical FSA, you only have access to the funds in a dependent care FSA that have already been deposited into your account. It also does not allow you to carry over any unspent dollars to the following plan year. Be sure to elect an amount that you know you'll spend by June 30th. Our dental plan is also through Health Partners. Your coverage depends on where you receive your dental care. As you can see from the chart, you will have greater benefits if your clinic is in benefit level 1. To find an in-network provider, go to Health Partners website listed at the bottom of the page. The dental provider network is different and completely separate from the medical network of providers, so be sure to check the correct provider listing. The district provides a term life insurance policy for all full-time staff members through the standard insurance. Please refer to your handout for the policy amount. You may also purchase additional life insurance at our group rates. Regardless if you enroll in any of our other benefit plans, full-time employees must return the life insurance enrollment form, so we can get a beneficiary on file for you. Long-term disability coverage is a district-paid benefit and available to all full-time staff. This is income protection if you have a serious illness or injury and are unable to work. Standard insurance also provides value-added services. The Employee Assistance Program, our EAP plan, offers free confidential services to all full-time employees and family members who may be facing some challenges. The Life Services Toolkit and Travel Assistance Program is also available for you and your family. If you are a non-licensed employee, you automatically become a member of PERA, the Public Employee Retirement Association. This is your pension plan. If you are a teacher or other licensed staff member, you will be a member of TRA, Teachers Retirement Association. The contribution amounts are listed in this section. Employees may participate in a 403B or 457 tax-sheltered annuity plan. A list of companies that you can invest with are listed on the benefits webpage, along with information for your financial advisor. You can begin participating at any time. Depending on your employee group, there may be a waiting period before you are eligible for a district matching contribution. Please refer to your handout or employee group contract for details. The Healthcare Savings Plan is a program through Minnesota State Retirement. After you retire or your employment ends, you then can use the funds in your account for eligible healthcare expenses and insurance premiums, all tax-free. Please refer to your handout or employee group contract for details. For detailed plan information, please refer to our website or appropriate plan administrator listed here. You have 30 days following your start date to return your insurance enrollment forms to Human Resources. If you miss that deadline, your next opportunity will be to enroll in the spring during our annual open enrollment, or if you experience a qualifying life event. You can send your enrollment forms through district mail from your building, or you can drop them off here at the district center. Send forms to Julie Siptar in Human Resources. Email and phone number are listed here if you have any questions. Thank you for your time, and I hope you have a healthy school year.